Joy News, independent, fearless, and credible. And from our studios here in Accra and around the world, welcome to the Tuesday's edition of The Pulse. And coming up this afternoon, PUC directs the Electricity Company of Ghana to within 1 week provide detailed incident report of power outages for the period January 1, 2024 to date, as well as the volume of load curtailed for each power outage incident, energy not served, and number of customers affected. We have details as the Commission demands ECG comply with the cash waterfall mechanism and pay all tariff revenue as prescribed and allocated under the mechanism. Also coming up in today's edition, kidney patients in Ghana can have a sigh of relief as government works around the clock to finalize a law which will now allow them exchange their damaged kidney for functioning ones. I'll also tell you about government partnership with vaccine manufacturer AstraZeneca to begin mass screening of Ghanaians before they develop end-stage kidney diseases. And should President and other Article 71 office holders get an increase in ex gratia, another a monument over the previous administration? The Pulse is brought to you by Global Communities, Igelu, affordable, safe sanitation for all. We're live on DSTV channel 421 and Go TV 125. You can follow us on Facebook, YouTube, and my Joy Online for these and more. We have a packed show for you this afternoon. Let's start with power because it's very important. And the Public Utilities Regulatory Commission, PURC, has given the Electricity Company of Ghana up to 1 week to provide detailed incident reports of power outages for the period January 1, 2024, and all ECG up-to-date report and the volume of load curtailed for each power outage incident, energy not served, and number of customers affected. This is contained in a fresh directive requesting ECG to respond to some key issues, failure upon which the PURC will impose sanctions, including 2-year prison sentence. And so what we have is a directive that came out this morning from the PURC to the Electricity Company of Ghana, requesting them to adhere to some key demands from the PURC, failure upon which they may impose sanctions on them. And very soon I'll bring you details of what the PURC put out there to the ECG to adhere to. One of them, key among them, is to provide some detailed accounts of fuel purchased and investments they've made, as well as the recent power outages, those affected, provide justification why, and also provide evidence to back claims that they informed the general public ahead of the power outages. These are some of the demands that the Electricity Company of Ghana has been requested by the PURC to provide, and they have from now till the 2nd of April to provide all of these requests to the PURC. So let's explore the issues put forth this afternoon by the PURC because it's very important. And if you have been following PURC and the ECG over the last few weeks, it's been back and forth regarding how the ECG is conducting itself and how the PURC is monitoring activities at the ECG. Now, joining me is Alhaji Jabaru Abubakar, Director of Regional Operations and Customer Services. Alhaji, welcome to the Pulse here on Joy News.
Thank you very much, and good afternoon to you and your viewership.
Right, Alhaji, so let's start by walking us through these key demands that we are requesting ECG to provide details for you, some within 1 week, some 8 days, but with the hope that by the 2nd of April, you would have gotten everything you want from the Electricity Company of Ghana. Walk us through these key demands and why they become so necessary.
Yeah, you see, it's very, very important sometimes where we put things in perspective. And as a regulator, we don't speak. Sometimes we conduct our investigations before we come out to communicate. There have been a lot of information out there because we have system challenges. And as a commission, we in the past have been publishing the cash waterfall mechanism distribution that was approved somewhere last year, the amended one. And that the reason is that the cash waterfall mandates ECG to collect money on behalf of the other stakeholders within the value chain. And when you collect, let's say you collect 1,000 cedis, everybody is entitled to some percentage, let's say 1%, 2%, some 20%, including IPPs, Greco, VRA, and other sector players who all have a hand in whatever you have collected. So it was to ensure that we have that financial sanity within the system so that whatever comes in, everybody gets a bit. And because of the cash waterfall mechanism, a lot of the sector players had gone into agreements and contracts with various players and their financiers. So if it's not working effectively, it affects the entire value chain. And that is what the Commission has been doing, publishing what ECG collects, what ECG declares, and whatever they give to the various sector players. So Greco, for instance, if you don't pay them, they might not be able to also maintain, their transmission networks. If you don't pay VRA, yes, they might have some plans that they will want to maintain. They might not be able to maintain that. So the IPPs, if you don't pay them the fuel supply, if you don't pay them, they might not have fuel to have. So the effectiveness of it is what we have been very, very particular about. So if there have been some system challenges, all we need to do is that we want to get the information from ECG, that is the person collecting the money, to cover the period so that we'll be able to make our analysis and be able to make a determination on that front. The second issue have been operational issues. We have a lot of customers talking about having bills that are estimated. So now people complain that normally historically, estimated bills were based on your contracted demand. And because of that, they were relatively low, because when somebody is building up a house or putting up his installation connections, there are no appliances at that point in time. So when they are doing the contracted demand, it's normally low. So but as and when the person moves in, it becomes very high. So it ends up to become low. So historically, estimated bills have been low. But what we started experiencing or observing with regards to ECG estimations were that they were very high. And a lot of customers have complained, and we've asked that they should supply us that information on that.
Before you go on, let's backtrack a bit and let's spend some time on the cash waterfall mechanism. And I'm just looking at your documents where you mentioned, for example, no payment to VRA, Gridco within a certain period of time. I remember that last week the ECG explained why they were unable to honor these payments, and they blamed it on the forest exchange and the fact that they needed to buy fuel to power the turbines, failure upon which we're going to be plunged into darkness. Is it your understanding that the explanation did not still down what we should? That's why you are now demanding a detailed response from the ECG in this latest circular?
Yeah, for purposes of education, regulation is all about data and information. Whatever you tell me, I will want you to formally commit that, and regulators hardly will speak. So if ECG says they have used that to buy fuel, give us the documentation covering the fuel you have bought. Give us the documentation covering whatever activities you have performed using some resources that was meant to go to other people. There are a lot of set-offs that happens within the sector. So that will be a basis for Greco to know that, look, this fuel was supposed to be procured by Mr. A or B. So because of that, let's do some credit notes to be able to set off these things. So as a regulator, we want to have proper energy accounting in the value chain. We want to have proper cost segmentation so that everybody knows that this is come here and this has gone there and this is gone there. And that is all that as a regulator we are looking at. So if ECG has given explanation, I might not be able to be able to confirm or otherwise until I get a documentation before us. And that is exactly what the PURC is doing. If you look at, there have been a lot of communication that has gone on out there. And as a regulator, before a communication should go out there, we expect that maybe you give us the information. Let us know this is what is happening. We are not saying that there can be outages in Ghana. Our systems have not developed, have not that matured to the extent that we might not have incidents of outages. We will have them. But to the magnitude, to at least the regulator should be in the know. If you are going to embark on maintenance, it is obligatory on the distribution company to inform the regulator within some specified period so that people will be communicated to. So if there are challenges, it is on to you just to let the regulator know. When they say load shedding doesn't necessarily mean that there should be generational shortage. Even when you are going to do your own management in terms of plant maintenance and all those things, it is obligatory onto you to write to the regulator to let the regulator know and give a reason why you want to do ABCD. If there are things that have been clocked in within the maintenance plan calendar, the regulator will just go and refer back. At the beginning of the year, you said you're going to make maintenance in ABCD. So yeah, it conforms. Then you take it. You are aware. If it is something that was not planned for or scheduled, then you will have to find out. There are some situations they write, other sectors within the value chain rise to say they want to do maintenance. And we look at the situation within some space and we say, can you push it back a bit? Because we have, let's say currently, for instance, we have these 13th African Games happening.
Right.
So if you are going to do some maintenance, let's say Greco wants to do some maintenance work, and we look at the systems are not that distressed, we can have engagement. Can we hold it a bit until maybe the games are over? Because we have, the country has invested so much. We have foreigners who are in here. What is the opportunity cost? Can we hold it? If it's what cost the system, can we find a way? Or if we can't even do it, where the games are taking place, can we try to make sure that we do it in such a way that they have supply whilst we take off places to be able to maintain the system? These are the way as a regulator we do. So we are just demanding, we are just asking questions that all what we have said, we have heard. We don't do our regulations based on the media or based on what people have said. Supply us the necessary documentations.
All right.
Based on what necessary documentation, we should be able to take a decision or otherwise.
Right. So, Alhaji, on the matter of operational matters, I mean, you come to a conclusion where you say that decline in quality of service delivery, including increasing power outages across ECG service areas, and this, according to you, started on January 1, and it's persisted up until now, increase in complaints, and then you come to this conclusion that ECG is charging unapproved connection fees. I'm wondering how you came to these conclusions.
Yeah, that's a different issue. Like I have said, as a regulator, we've been doing a lot of monitoring. Before we get to a regulatory order, that means that we would have conducted a lot of things. There are some new connection charges that ECG has introduced without getting an approval from the regulator. So they say if you are somebody who wants a single phase meter, this is how much you are to pay. And it was published across some of their rural districts and later some of their urban districts. So we have the charges that were advertised. So we quickly wrote to them and said they should suspend that and provide us the necessary data. If there's a need for us to give them approval, we will do that. You've also heard about their premium services, or they have some name they gave to it, where they say they can give you service within a week or a day and you pay this premium service and those things. It is a brilliant idea. The regulator do not prohibit such things. But you see, all what we have to do is that we make sure we approve whatever you are doing. If somebody wants a first-class service where I will sit in a place, then I have a coffee, and maybe people will come and fill my phone for me and assist me, it's a brilliant thing. But we are in a regulated system. where whatever you are bringing, we want to ensure that prudent cost, the investigations of the cost are done, and we are sure and convinced that we are not shortchanging one person or the other.
So in effect, you are saying that as a regulator, you were not informed of these charges implemented by ECG, under normal circumstances, they should have informed you. That is basically what you're saying.
No, you don't even inform us. You need an approval.
So that makes the charging illegal, isn't it? That makes the charging illegal.
For now, that is why we are ordering them to supply us all the necessary things. To make it legal or illegal is the mandate, is something that is vested in the hands of the commissioners who issue the order. So for me, I'm just trying to explain to you what an order was given. So when they supply the information, the commissioners will determine otherwise. If in their charge it is illegal, then the pronouncement is done, and whoever has breached the regulatory laws will have to at least face the sanctions on that.
And very soon, I'm going to bring in lawyer Kwame Jantua, he's an energy analyst, as we explore this latest position taken by the PURC. But again, Alhaji, I mean, copies of all government directive to ECG for the purchase of fuel for power generation from August. So now the total amount of fuel procured for power generation from August last year till now, together with fuel supply contracts, invoice, details of fuel quantities, details of all bank accounts and investment accounts currently operated by ECG, monthly bank and investment statement corresponding to each account showing balance for the period of August up till now. Some will say that as a regulator, and you are demanding answers to these matters, I mean, you've not been up to your responsibilities, because these are quite, deeper issues that you are asking for, and on a day-to-day operations of the ECG, you should be aware of how these things are done.
Yes, there are some operational reports they submit. These are not operational reports that usually they submit to us. They submit their purchases and sales to us. But you see, there are now issues that has come out that ECG has made some purchases about fuel, which to us, a distribution company, personally, a distribution company is not supposed to be doing that. So if they have done it on the authority of a shareholder or whoever the authority has ordered them, we just want to know what are the invoices, how much did it amount to, what is the period. Let's look at it.
So you are blind to all of these things. You are basically blind to all of these things. Like you asked, you are basically blind to all of these things, at least for now.
Let me make it clear that it is not supposed to be done that way. The cash waterfall, you are supposed to collect the money and pay everybody within the value chain. It's not onto an individual disco to determine how he appropriates whatever resources has come in. So now, if we have gotten the information to the point that something is being paid outside the cash waterfall mechanism, then that is something strange to the regulator, because we all know that this is the mechanism that we have in place. Look, in some jurisdictions, what would have happened was that, but ECG has shareholders and they have their managers. It should have been automatic, so that whatever money comes in is shared in accordance with everybody. But because they collect the money, they have to account for it. So whoever within the value chain, you have maybe collected 1,000 cedis, 12,000 or 20,000 cedis, then everybody will get a share of it. But if you now take it outside, what you have collected the money on behalf of all of us. So if I take the money and I am now deciding how I spent it, as a regulator, all we need to do is that let's get all the necessary invoices, payments, so that we validate to know that maybe it was done appropriately or not. And that is what, as a regulator, we are just doing.
And for you, how is ECG's refusal to pay, for example, VR and Greco, how is that affecting their operational capacity?
Oh, you don't know? You don't know some of their plants are out because they couldn't maintain them. You don't know Greco, some of their systems are failing because they couldn't maintain them. You don't know that because of some situations, some of the power plants do not have fuel. Why would ECG buy fuel? If they were paying, there would have been enough money for fuel people to buy. So why should ECG now go to be buying of fuel? These are all objective issues that as media, we should investigate. What is ECG business in buying fuel? And the individuals from ECG can make such issues that, they were directed to buy fuel. As what? These are some of the real things that we have to be very, very careful. You see, we have a value chain. Collect the money, give everybody in the value chain. Let Greco be able to maintain their system. Let ECG take your portion and maintain your system. It is not for you to appropriate to every individuals how much this person should get, or do they deserve it or not deserve it, irrespective of what.
And you have served notice and giving clear guidelines, deadlines upon which ECG is expected to provide these answers. The first one elapsing on the 25th of March, the last one on the 2nd of April. And you provided some powers that you have, including sanctions. The ultimate one amongst them is imprisonment for 2 years. How willing or how far are you willing to go to ensure that what you have put on paper, you actually go by it in the event that ECG is unable to provide all the information that you require?
You see, people don't know, because this one, at least, because this order has come out to the media, that's why they are talking about it. We have done that before. We have done that before to other regulated entities, and they are aware.
You imprison somebody?
Oh, not getting to that extent, but they had to comply. You don't call the bluff of the regulator. Honestly, it's only, because mostly because sometimes because the regulator is diplomatic and those, and that is why sometimes people are taking those powers for granted. No, you don't call the bluff of the regulator. The issue is that the regulator has the right to demand all whatever documents, and the law is very explicit on that. If the regulator has the prosecutorial powers, they could even go to court on that. But in this case, we have not gotten there, and we are expecting that at least ECG will comply and bring the necessary documents so that we are able to at least sanitize it. We are not interested in whatever, in getting somebody imprisoned or surcharging anybody. No, all we want is to have a very effective power sector. All we want is that businesses will be able to operate without hindrance, and will have reliable supply of, and everybody will be happy.
And my final question will be, somebody who is sitting somewhere and observing what is going on may come to the conclusion that all may not be well between the ECG and the PURC. There may be some personality clash somewhere that is now coming into the public domain. So who suffers? Me, the consumer. I remember after work one Sunday, I went home. I wanted to watch television. I put on my TV. It wouldn't come. Later, when I got a technician to look at it, the conclusion was that because of the power fluctuation, my TV screen had collapsed. And for that reason, I needed to change it. Now, the screen alone was going to cost me 17,000 Ghana cedis. As a consumer, somebody without any fault of mine, I'm being made to pay for something I didn't plan for. What are the remedies available for somebody like me, for example?
Before I come to the remedies, you see, we have to correct some perception. ECG cannot clash with PURC. It is just like telling you that a civilian is clashing with a police person. We are their police. And you owe a duty to respect the police at every point in time until you go to the law court or otherwise.
You are not getting the needed respect from ECG?
No. You said clash, and as an innocent person, I just want to us to know that it's like somebody is supervising you. So you don't go to extent to let it look like you and the person. No, we are just demanding that the right thing should be done. That is all. It has nothing to do with personality clashes.
Right.
And also, because we've been very collaborative, the regulation that PURC do is the collaborative, regulation. We don't get up and just sanction on order. Let me tell you the basic reasoning behind the Commission's position on that. Because ECG is 100% government owned. So you sanction them, you end up sanctioning, government. You understand? Because the individuals who are managing it sometimes may walk scot-free. If that's with monetary, they pay. Imagine if it is MTN, which is private, and you are going to sanction them, the shareholders will demand serious accountability from the management. But because it's government, we've been very, very collaborative and those things. But it's like it's becoming something that, as a regulator, we have to make sure that we demand that the right thing is done. People get up and they always say that PURC is sleeping on the job. PURC is sleeping on the job. It is not that. We've been doing a lot of talking. We've been doing a lot of investigation. We've been doing a lot of monitorings. And we have demanded that bring us this for us to reconcile and see how best we get the system okay. That
and
is
the
all
remedy,
that
and the remedy, Alhaji.
yeah, the remedy, anybody within the regulated market who suffers maybe damage of the appliance, all we need to do is to investigate. If as a result there is established that you lost your gadget because of the power fluctuations or as a result of voltage issues, then you can be compensated for it. A replacement of that gadget is done. We've had such cases. We've had even situations where people who lost homes have been compensated and it's only not only in ECG,
right?
It's even both NETCO and ECG. So we've had some of this. And there are normal operational issues that we face day in, day out. And I should pretend over those complaints, at least up to mediation. And when mediation fails, then it goes to formal hearing. And formal hearing, let me take the opportunity to let people know.
Just briefly.
It is like a court where a determination is made. And when the order is made, like yes, this order, you don't flout it. You know, if you flout it, you are putting yourself in a position that you will cause the bluff of the regulator.
Right.
And like I said, the regulator is the supervisor. We are their police, so you can have problems.
You can't have issue with the person you are regulating. No, thank you very much, Alhaji Abubakar, for your time this afternoon, for explaining the rationale behind this directive to the electricity company of Ghana. We tried to get a response from the ECG. They are unavailable for now. They say that they will issue a formal statement in due course. But let me bring in an independent watcher in all of this. I mean, this turf war between the PURC and the ECG, if you like. Lawyer Kwame Jantua is an energy analyst. Lawyer, you're welcome to the pause here on Joy News. And my apologies for keeping you on the line, but I just needed you to understand the context upon which the PURC is coming in and then try and get your experts' view on this matter. What do you make of what is going on? Is this a turf war, personality clash, somebody trying to feel powerful over the other, or really the PURC doing what is expected of them finally?
Elton, good afternoon. Nobody wants to be caught with their pants down. PURC doesn't want to be caught with its pants down. ECG also don't want a situation where they are exposed. The situation is getting worse. And at the present moment, PURC feel that the way it's getting worse, if they are not seen to be acting, it can cause challenges. And from what I see, ECG too don't want to open up as to what the challenges are. I do not understand why they are having this kind of spat in public. The regulator is a regulator. The distributor is a distributor. They should be able to talk and work together. Look, they had a meeting in Flagstaff House with the president with regards to cash waterfall and other issues. And from what I've learned from it is that there were challenges with ECG and the cash waterfall in terms of they bringing in other companies that weren't part of it and they weren't even considered. So the president said from what I understand, said to PURC, go and revise this cash waterfall so that it takes into account everybody. What went wrong? And maybe the major challenge is that the amounts of money that ECG are supposed to collect, and from what I understand, it was between $1 billion and $1.9 billion. If they haven't been able to collect that money, isn't it a question of sitting across the table with PURC to tell them we are not able to do X, Y, Z, so let's see a better way around it? Shouldn't that be the case? I really don't understand it. And even when you look at the punishment, the sanction, look, will ECG have the money to pay the sanctions that PURC is requesting? For me, this part should stop. There has to be someone who can bring both sides together and let sense reign, because it's the customer who is suffering.
Exactly.
It is getting worse. Something has to be done. Something has to be. Maybe they go back to the president, or they get probably the civil society, calls both sides, sit and sort the challenge out. So you punish ECG for not bringing what you're requesting. ECG doesn't have the wherewithal to pay. What happens? Does it solve the problem? It doesn't. Let's find ways of sorting this problem out. Let's find ways. And I'm ready to sit in between them, on even civil society, to sit in between them and see how we sort this out, because it affects all of us. It's a national issue. It's not an institutional issue. It's a national issue. And if civil society can't do it, then the president should step in. The Ministry of Energy should step in and sort this out. It doesn't look good.
Because I'm asking lawyer, and this has to do more with some of the issues raised by the PURC in this latest directive to the ECG. Now, one of them is about the cash waterfall mechanism, where PURC is quite emphatic in this statement that ECG defaulted in the payment to Gridco and VRA. Now, last week we were told by the MD of ECG that they had to use some of the money to buy fuel so that they were able to keep the lights on. Now, shouldn't this be an explanation that should center around this key state institution such that it doesn't have to be battled out in the public domain? Clearly, something is not well, and both sides are refusing to admit that there's bad blood between the two of them. Who do you suggest should sit in between the two of them?
Say that again.
This matter?
Say that again, Elton. I didn't hear the last bit.
Yeah, so I was saying that. So how do we resolve this matter going forward? Who should sit between the two of them? Because clearly there's bad blood between the ECG and the PRs, and everybody is out there to take their pound of flesh. I need electricity 24/7. That should be of concern to me. How this affects how I get electricity is my concern as well. So how should this be resolved going forward?
Elton, it shouldn't be taken as a personal thing. It shouldn't be taken as a personal thing, because these are institutions of the energy sector and institutions of government. And the challenges going on affects everybody. And so some higher body, if not the Minister of Energy, if not the Chief Director, if not the President himself, someone, probably civil society, should try and get both together. And in getting both together, it's not only the two, but the board chairs of both PURC and ECG should be at that meeting. What is it that is causing them to fight in public? What is it?
Do you know as an industry watcher?
From what I see, probably a PURC have got on their last legs and feel, look, this is all we can do now, because we are not getting any response from ECG. ECG too probably feels they have a genuine challenge where finance is concerned, and they expect PURC to understand. If there is this backlog, this in and out, then we have to solve it. Because I don't see it as a personal thing. I don't see it as something that the managing director of ECG and the managing director of executive director of PURC should be at loggerheads. It is not right. They are regulator, you're a distributor. We have to find a middle ground to talk. We have to, because it's getting worse. And government doesn't want to say it's doomsday. And ECG find it difficult to say it's doomsday because the government doesn't want them to say it's doomsday. And PURC too are seeing the challenges that are there, and they don't want to say it's doomsday. If it is doomsday, say it is doomsday, and let's see how best we sort it out once and for all. Because it doesn't reflect good on any of them. It doesn't reflect good on PRC. It doesn't reflect good on ECG. It doesn't reflect good on government. So we have to sit and talk. Why none of them want to sit and talk boggles my imagination.
And my final question will be, PURC makes it clear, quality of service has deteriorated. ECG is undertaking the charging of illegal fees. They are even requesting evidence of, announcement to the public ahead of the power outages. They are requesting all of these. From where you sit...
Why now?
Yes,
why
exactly.
Now? I ask the question, why now?
And that for me is very interesting. That for me is very interesting coming from a regulator.
When did this particular issue start? From the word go, if PURC needed to send this, from the word go, this is what should have gone on. But there were discussions. I told you, they had a meeting with the president at Flagstaff House. All of them were there. They discussed it at length. So if those negotiations were going on, what has caused them now to bring this out? Something is amiss in there somewhere, and we need to be able to sort it out. I am not ready to point the blame at anybody. I am ready for solutions because the ordinary Ghanaian is suffering. Suffering.
Right. Thank you very much, sir.
If it is doomsday, if it is doomsday, and it's not full doomsday, and it's partial doomsday, let's say it. If we need to bring a timetable out, let's bring it out. Forget the politics. Take the politics out. And this is where the politicians come in. Take the politics out. If it's partial doomsday, tell the people it is partial doomsday. Maybe ECG also do not know where, if they say it's equipment, where equipments will malfunction. So they are finding it difficult to bring out. But you definitely know that there are the areas where maintenance is required. Let's open it up. For me, if I were there, I would say, look, what we are experiencing today is a form of doomsday. Let's admit it and let's see how best we move forward on it together as a team.
But Mr. Jantua, if indeed it is true that the ECG used the money that was allocated for VRA and GRADECO to purchase fuel based on directive from the Finance Ministry, that the Finance Ministry of government, for that matter, should be able to refund the money so that this matter is put to rest once and for all.
There is part of the cash waterfall that the Finance Ministry has taken responsibility to pay. Have they paid it? For the level 2, they divided it level 1, level 2. Level 1 being the generators, level 2 being the SOEs, which are government companies. And they have taken responsibility, I'm not sure whether it's for GRADECO, but they have taken some responsibility to pay. What has caused them not to pay, if they have to pay? That is why I'm saying we should stop this back and forth and sit and discuss it and find solutions. For me, that's the most important thing. This back and forth doesn't help anybody. It just brings stalemate. And people are, holding on to their positions. It doesn't work for anybody. It's the ordinary Ghanaian who is suffering. And the ordinary Ghanaian pays their electricity bills.
All right.
You cannot say they are not paying. They are paying their electricity bills. Well, those who are paying are paying. And I'd like to think majority of Ghanaians pay their electricity bills. And if there are challenges, we need to see those challenges and sort it out. This won't help us. Help us, please.
All right, let's leave it here. Mr. Kwame Jantua, energy analyst and a private legal practitioner. Thank you very much for your time. Alhaji Jabaru, I understand you want to make a quick intervention here. I'll allow you some few minutes.
Yes. Thank you very much. I like the bit he mentioned that the consumer is suffering. I know over 60% of consumers are prepaid customers. They pre-finance. And if they don't have power, that is where the regulator comes in. You see, we started demanding this documentation, especially with the transformers, when we got the information that about 630 transformers were overloaded. If you have some of this data or these challenges, it is for you to bring it to the regulator, not for us to just get it from the media space and all those things as a result of what we are having in it.
I remember the MD was the one who put out this information that they realized that most of their transformers are now operating at 100% capacity. The reason why there's this power trip here and there.
You see, that is what I'm saying from the technical point of view. That shouldn't be said. That means that there was no planning. You have system planners within ECG. And I believe that if such statements are coming up, that means that somebody is not doing something right. And that is why, as a regulator, we are demanding the data on it. And if it comes out to be clear, to be true, then that means that somebody was not doing something right. And we know, that's why we are asking for the locations of those things, because we have the capacity to verify and monitor, because we have been monitoring some of the transformers randomly, and we know. So if you are not telling us something, we need to verify the information. As a regulator, you don't hurriedly make comments. And that is why we took our time. People who had always mentioned that PURC was not saying anything, because we were gathering the facts, we were doing the analysis, and that is the right time that we have come. And we are demanding some of these documentations. Please, let's try to desist from personalizing the issue. It has nothing to do with personalities. It has to do with the system working, and for Ghanaians who are paying their bills, enjoy the services that they are paying for. And then the PURC has given the tariff required for the investors. That is ECG, Greco, and VRA, and the IPPs. So the customer base has to be protected, and that is why we have to ensure that we have reliable supply, because we have given the tariff, and we have to ensure that at least quality of service is delivered to the customers on the other hand.
And can I ask you this for just 30 seconds? Can you confirm whether President Akufo-Addo met the two of you and said that you should take a second look at the cash waterfall mechanism in a way to bring lasting resolution to this impasse?
Oh, but when you read the order, you realize that they are making reference to that cabinet, things, and that is why they don't say cash waterfall. They say the amended,
right? Because
there had been cash waterfall for a long time, and some of these concerns were addressed, and they were saying that moving forward, you have to go by this. And since then, there have been irregularities, payment made outside of cash waterfall, and that is why they always will say the amended cash waterfall mechanism, not the cash waterfall, because cash waterfall is older than the period we are talking about. Thank you very much.
Thank you very much. Alhaji Jabaru Abubakar is with the Consumer Services Department at the PURC. Thank you very much for your time this afternoon. This is a pulse here on Joy News with me, Elton Brobe. Now let's turn our attention to some other stories now. And the Office of the President has requested Parliament to refrain from sending the Human Sexual Rights and Ghanaian Family Values, commonly referred to as the anti-LGBTQ plus bill, to President Akufo-Addo for his assent. The decision, according to the Secretary to the President, Nana Bediatu Asante, stems from the acknowledgement of two pending applications for an order of interlocutory injunction before the Supreme Court. The application seeks to prevent Parliament from sending the bill to the President and to refrain the President from signifying his assent to the bill pending the final determination of the matter. And we have details of the letter that was written by the Secretary to the President, Nana Bediatu Asante, to the Clerk of Parliament, and portions of it talks about the fact that while the President was meeting his cabinet, it came to the attention of this office that while the President and other senior officials of the Presidency were at PURC for a cabinet retreat on Thursday, 14th March 2024, you attempted, and this letter is referring to the Clerk of Parliament, to submit the Human Sexual Rights and Family Values Bill 2024 to the Jubilee House for the President to signify his assent or otherwise to the bill. And it goes on to say that the office is aware of two pending applications for an order of interlocutory injunction, both filed on March 7, 2024 in the Supreme Court in Dr. Amanda Odoi versus the Speaker of Parliament and the Attorney General, and Richard Delaskai versus the Parliament of Ghana and the Attorney General, respectively. And the communication goes on to emphasize the point to refrain you and Parliament from transmitting the bill to the President, and also to refrain the President from signifying his assent to the bill pending the final determination of the matter. And this is a matter that's ongoing. The Attorney General has, by a letter dated 18th March, informed the President that he has been duly served with both applications and has advised the President not to take any step in relation to the bill until the matter raised by the issues are determined by the Supreme Court of Ghana. And so it goes on to make some demands. It says, it is understanding of this office that both the applications have also been duly served on Parliament. Therefore, it will be improper for you to transmit the bill to the President, and equally improper for this office to receive the bill until the Supreme Court determines the matters raised in the suit. So this is a letter signed by the Secretary to the President, Asante, and it says it is settled law that during the pendency of an interlocutory injunction application, the status quo ought to be preserved and no action should be taken that will result in prejudicing the injunctive relief sought and undermining the authority of the court. And for that reason, the President, they ask that the clerk desist from such acts until the final determination of the matter. Now, some members of Parliament are unhappy with the posture of the Presidency, especially the Tamale South Member of Parliament, Haruna Idrisu. They see this as an infringement on the independence of the legislature. Listen to Haruna Idrisu makes the point at the news conference in Parliament earlier today.
To sleep because this is a monumental threat to Ghana's democracy and a monumental threat to Parliament as an institution. By Article 93, we are clothed with legislative authority and legislative mandate. This letter only reflects President Nana Addo Dankwa's quest of predominance over other organs of state. That is unacceptable, and that must be fought by all persons who love democracy and who cherish the principles and values of the 1992 Constitution. The framers of our Constitution endowed Ghana with separation of powers, the executive, the legislature, the judiciary, division of powers. It endowed us that Parliament shall be responsible for lawmaking. President Nana Addo Dankwa, first of all, politically, what power does the President Secretary have writing to the Clerk of Parliament, and not the President himself writing directly to the Speaker of Parliament, as is required of our standing order, so that officially this can be read as communication from the President. So ideally, this paper means nothing and should be ignored by the clerk, because communication to Parliament must be communication signed by the President, addressed to the Speaker of Parliament, as is required of our standing orders, whether old or new. Yes, there is a matter before court, but I'm also a trained lawyer. An attempt to seek an injunction is not the same thing as an injunction. An attempt, I'm seeking an injunction, does not operate the same way as an injunction have been so granted by the court, even if it is an interlocutory injunction. But more importantly, Parliament cannot be enjoined not to perform its lawful function as the legislature of Ghana, clothed under Article 93, responsible for legislation. No organ of state. Subject to the Constitution. The judiciary is subject to the Constitution. The executive subject to the Constitution. The legislature subject to the Constitution. So it's for good reason that all of them, the Constitution says, subject to this Constitution. The legislative authority is vested in the Parliament of Ghana. Now, somebody should help me with the 1992 Constitution and open Article 106. Then 2, the President cannot, by any shred or shadow of authority, seek to injunct Parliament from exercising our lawful duty and responsibility as the House responsible for lawmaking. Neither the courts can enjoin Parliament not to perform our duties as Parliament. The courts, under Article 2 of the Constitution, can declare a nullity or a void to the extent that Parliament have passed a law which is inconsistent with the Constitution. As far as me, I'm concerned, even with my understanding of the law, there is nothing before the court because a bill remains a bill. Until it's assented to by the President, it is not law. Therefore, as far as I'm concerned, there is nothing before the court that somebody will seek to use that to injunct us from performing our lawful duties. That's why the Constitution in Article 106, if those of you who are familiar with it, it reads, the power of Parliament to make laws shall be exercised in bills passed by Parliament. In bills passed by Parliament. So Parliament has passed Human Sexuality Bill, assented to by the President, Article 106. It has not been assented to. So there's no law yet. So whoever is seeking to question a law must show us which law he's referring to. But Article 106 imposes an obligation on President Nana Addo Dankwa Akufo-Addo as the executive head of the Republic of Ghana. It says that when Parliament passes a bill, Parliament shall remit the bill to the President for assent. That is what this Bedioto letter is seeking to do.
Well, there's been more reaction to this developing matter. That first came from the Office of the President. You heard the Tamale South MP, Haruna Idris. Now, flag bearer of the NDC, John Dramani Mahama, has condemned the character of this letter from the Presidency, directing Parliament to refrain from sending the anti-gay bill to the Presidency for his assent. According to him, it is unlawful for the Secretary to the President to alter such a letter. Speaking at a town hall meeting at Banda as part of his tour of the OT region, Mr. Mahama believes such a directive to Parliament is contrary to the dictates of the 1992 Constitution.
Afe osofo kasa oka LGBTQ asem nia oba etimi ware oba bema timi ware bema yina yenim se yamamre enya dia yamamre ejitum esum bia ewo Ghana hebia enjintum Christo sum enjintum Islam enjintum abosom fompo enjintum enti eyade eyechiwade ema yenkrofo Parliament na say omo aye krata a omo wie hu adwuma a omo de call president or no assign na president akase on sign if you say obi de asem no akọ court anti ono obetwen etie ni court beka answer and so no pay me sorry me who letter be a free president secretary ho e Parliament a man warning say sakrata no more farm ma president office mpo na obi obeye lawyer obi oye lawyer bia beka cho say president secretary need to me say obetimi atro so letter no if you say Parliament constitution and ashem rama omo say omo ye sa eyi ni wi a omo fa nko president ho enti untimi nka say ma onye ne juma say on famre ompo obetimi aka say obi say ma president and sign enti me twen etie Supreme Court but untimi throw letter and ma clerk say mo on fa ma president as Jubilee House o enti no na wo hwe senya otro letter no mpo a enye buo otro letter no bibibi to say o tumi bi echa in Parliament na sa nyoma no say emma amambo no enkoye enti yedim say ye NDC de ye di mra so na ye behwe senya enyoma beko akosi.
And that's the NDC's flag bearer, John Dramani Mahama. I mean, talking about the fact that the Presidency has no right to deny the transmitter of this bill, the anti-LGBTQ bill, from Parliament to the Jubilee House. And he also talks about the fact that the tone and the language of the letter doesn't, portray somebody that respects the authority of Parliament. And for that reason, Parliament should be allowed to be independent in the discharge of its duties, while the executive and government also, that's what they consider to be within their own Right. This is the pulse here on Joy. Now we have a breaking news from Ahanta in the Western region about some crash. And my colleague Kojo Brace has details. Kojo, what really is happening here?
So what we do know is that a military helicopter belonging to the Air Force Base in Takrade has crashed in a town called Bondosua. Bondosua is a community along the Agunankwanta and Descove Road. People cannot tell exactly what was wrong, but you could just, imagine that it could be a mechanical fault. Now, they say that this helicopter hovered around the area for some time before crashing into the trees there. We understand that the military has rushed there. They've dispatched 5 ambulances to the area as well. And then we also have...
And so the video we have on our screen is the crashed helicopter?
Yes, exactly. So this is the crashed helicopter which is lying there. Another helicopter has moved to the area, that's the Bondosua we're talking about, to, in essence, evacuate people that they could. But the ambulances are also there so that if there are any medical emergencies, they can. What our source there is telling us is that they are not able to confirm whether or not people are dead, but they have not heard anything like that. And they have not...
And nobody has been taken out of the crash helicopter yet?
So they say they cannot... The military is not allowing people...
Anybody access?
Exactly.
Right.
But they see 5 ambulances there so that in case if there is any casualty that needs the service of the ambulance, they can transport the person there. I was asking who were on the chopper. The person said that, in the area every morning, those choppers do take staff who work on the rigs to the rigs and then bring them back. So they could imagine that or
some of them could be oil workers.
Yes, one of them. Now, someone said one lady, the person said nobody was injured, but one lady was overwhelmed by what happened. And so, but the people were able to, stabilize her. So that's what one person was telling me. We're still gathering info as to whether or not someone really got injured because you know how this chopper is lying down there.
Right. And they are also unable to tell what may have caused the accident?
Yes, they are not. Because the military is not allowing people there. They are not telling anybody whatever. We are now trying to get the military to tell us exactly what happened. But they say that they could anticipate or, expect it to be a mechanical fault because it hovered around the area for some time
before crashing.
Yes. So that is what is happening. One chopper is there to give an assistance to whatever is happening there. But we have an eye on this, and then we'll be bringing... So we've now put the video of the second chopper. I think that will be coming up shortly. The second chopper that came to offer support to the crashed one. But we have our eyes and ears on the ground, and then we'll be updating our viewers as to the sort of information that will be.
Right. So for folks in this area, the hovering of helicopter is actually a daily occurrence.
Yes. Every morning when you wake up, you are likely to see a chopper flying over because it is taking people to the...
So what we are seeing is after the crash?
Okay, yes. So this is the second chopper that has come to offer support. And where it is standing on a football park of the Bondosua community. Bondosua is the second community after Agunankwanta when you are going towards Descove. So the chopper has landed on the school park. And like I said, it's probably to offer support to whatever rescue operation that is going on. So this is what is currently happening there. We have our eyes there so that we could understand what exactly is happening. We're knocking at the doors of the Air Force so they can
to give us some information
exactly about
as of now.
What we do.
So again, what is the name of the town?
It's called Bondosua.
Bondosua.
Yes, Bondosua.
In Ahanta.
In Ahanta. So people will say Bonso Chrome. It's called Bondosua.
Yeah. All right. Thank you very much, Kojo Brace, for this update. And the breaking news this afternoon is that a helicopter belonging to the Ghana Air Force has crashed at Bondosua.
Exactly.
In Ahanta in the Western region. And we don't have much information yet. What we do know is that the Ghana Armed Forces, they've deployed some men to help with the rescue effort. It's unclear whether there's injured, there are casualties, but this is a breaking news that we are following up, and we'll bring you more details as and when we have them. This is the pulse here on Joy News with me, Elton Brobe. We will take a short break, and we will come back. We'll talk about kidney and the good news for you if you are suffering from kidney. Welcome back to the Pulse here on Joy News with me, Elton Brobe. Now let's talk about a very important matter. We are talking about health. We are talking about kidney. Now, barring any last-minute hitch, Ghanaians whose kidneys are damaged can have it changed with a functioning one from a donor. A law which will allow organ donation and transplant is expected to come into force by the end of this year to help deal with persons who need to replace their damaged kidney, eyes, or even heart. It is part of a wide-ranging measures set in motion by government in response to the rising cases of kidney disease among Ghanaians. Now, Presidential Advisor on Health, Dr. Anthony Nsiah-Sarem, has been sharing details at an event where a new initiative dubbed Healthy Heart Africa was introduced today by vaccine manufacturer AstraZeneca in partners with the government to deal with the rising kidney problems.
Working around the clock with the Minister of Health, there's a draft document which has been sent to the Minister of Health by a group of health professionals who have interest in tissue and organ transplant. So there should be tissue organ donation and transplant law so that people can donate, for example, their eyes for cornea transplant. They can donate their heart, they can donate their kidneys or whatever if they have an accident or in case of accident or in case of death. We should have a law passed by Parliament, out of Parliament, to back it so that there will be no legal issues of organ donation and transplantation. And this is what we are working together with Ghana Health Service, with the Minister of Health, to make sure that we have a policy, we have a legal document which will go through Cabinet to Attorney General, will put it in a legal language, and go to Parliament to be passed. We are working very, 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 very hard that we get this thing done before the end of the term of this present Parliament, which ends at the midnight of 6th of January 2025. So we're hoping that we'll get. They say that the most important thing is getting the document together. The document, a very good document, has been prepared, which is at the Ministry of Health. What is left to be done is that a group of stakeholders have to meet, go through the document, and then the ministry then prepare the document, the policy document, which will then be launched, and then to be taken to Cabinet for Cabinet to also approve it and send it to Parliament for the law to be passed. So there's a series of things to be done, but I'm very hopeful that with about 9 months left, we should be able to do it and pass it before this Parliament recess.
Now, Deepak Arora is Africa Cluster Country President at AstraZeneca and has been explaining the new initiative.
Integrating along with hypertension screening and diagnosis, also chronic kidney disease. And as you know, 11% of these patients are suffering in Ghana silently. By improving screening and diagnosis, what you're doing is you're building capacity and capability of early screening, diagnosis, and treating these patients so that they don't progress into last stage of chronic kidney disease, where we know they end up into dialysis. And dialysis is very, very expensive. A lot of healthcare burden goes into it. We have been doing Healthy Heart Africa from last 2019, and we've screened around 9.6 million patients. And now what we're doing is bringing chronic kidney disease also part of the NCD prevention. Ghana is the first country to launch Healthy Heart Africa 2.0 versus the other countries which are already executing Healthy Heart Africa. So we're starting with Healthy Heart Africa 2.0 in Ghana, and then we'll be moving to other countries as well in Sub-Saharan Africa. So very, very excited. The impact is about prevention. The impact is about bringing healthier outcome, halting progression of chronic kidney disease in the patients who have a high risk because of hypertension and diabetes.
Well, the new code will be implemented by doctors working under the Ghana Health Service. Dr. Akusia Sapon is Greater Accra Region Director of Health Services and has been explaining how the new guidelines will be implemented in this regard.
I'm so excited with this guidelines or protocol introduction. You know, hitherto people end up having the end-stage kidney disease which will mean that they will have to go through dialysis with this attendance cost to the country, to families, and to individuals. And we know that there are some risk factors or certain conditions that predispose people to this chronic kidney disease. And one of them is hypertension. You know, hypertension prevalence among the adult population is over 30%. Yet a lot of people walk about and they are hypertensive, but they don't know their status. And therefore, their kidneys gradually get damaged. And if they are not recognized early, or identified early, or diagnosed early, then they end up with end-stage kidney disease. But with the introduction of this protocol, you know, there are levels of kidney disease: stage 1, stage 2, stage 3, stage 4, and so on. And if we implement these guidelines, we'll be able to identify the stages early enough and intervene and treat, and therefore prevent people from getting into the end-stage chronic kidney disease, which end up with dialysis and ultimately kidney transplants or kidney transplantation. So I'm excited with this protocol. It means that our facilities at every level, you know, can read the protocol, understand, and then start implementing, and therefore we'll be able to integrate it into our routine health service delivery. So it is good. We are going to ensure that this protocol is disseminated to all the levels of care, right from our regional hospitals to our district hospitals to our health centers and CHIPS facilities, so that they understand and then start screening people early to identify early disease for management, so that they don't progress to the end-stage kidney disease.
So this is very good news, especially if you are suffering kidney and you are going to dialysis treatment. Now, the good news, as we heard from Dr. Nsia Sari, and of course, Deepak, who is here with me in the studio, I mean, it is good, whichever way you look at it, but how is it going to work? I'm joined in the studio by Professor Samson Entry, President of the Ghana Kidney Association. Also with me is Deepak Arora. He is the African Cluster Country President at AstraZeneca. You're welcome, gentlemen.
Thank you so much for having us.
Yes, great. So, Prof, let me start with you. This will be a very welcoming news.
Yes, it is, indeed. I think Ghana Kidney Association, thanks Joy FM. Last year, we had a dialysis crisis. We were in the news. We all worked together to try and create awareness and advocate for some intervention by government, and I think something happened subsequently.
Right.
Polibu is running it at an affordable cost, the dialysis. But like Dr. Sapon said, our focus as a professional group is not to wait till people get advanced kidney disease. That will definitely be a defeative approach if you go that way. And so to educate people on the risk factors of chronic kidney disease, advocate for early screening, early intervention, and this will slow down progression to the end stage, where it becomes very costly because we need dialysis or transplants. And so Ghana Kidney Association, one of our major missions was try and develop a protocol or guidelines that we made available to all cadre of health staff in the country, so that they will identify those at risk and then screening procedures and how to diagnose CKD and what we can do.
This afternoon, for example, I got to understand that usually when people report at the hospital, they are always at the end stage of it. And it's difficult to reconstruct or restructure whatever is left of it.
Yeah, at that point, treatment becomes very difficult. And like Dr. Sapon said, so there are 5 stages of kidney disease. If you are stage 1, that's the earliest stage. We can say you have got CKD, chronic kidney disease, but your function is correct. Your kidney is functioning very well. So at that point, if you intervene, for example, if the risk factor is hypertension or it's diabetes, and you control the hypertension and also control your blood sugar, then it will take you a long time before you get to the end stage.
So you can live comfortably.
Yes. We have seen people who are diabetic because they are well controlled. Probably 20 years, their kidneys are intact, controlled. And but if people don't know that they've got hypertension because they are not screening, they don't get their BP checked. Somebody hasn't gone to hospital for probably 5 or 10 years.
Yes, and it feels that it's very okay.
Yes,
because,
okay.
Yes.
Hypertension will also not give you symptoms. When it gives you symptoms, it's killing you. Probably get a stroke. And so we are just advocating for people who are at risk to have screening done. So that if we screen you and we identify a problem, either it's blood pressure we are checking or blood sugar we are checking, and you have got any of those problems, interventions are done. And so this protocol that we have developed with our partners, and we are very grateful to AstraZeneca for funding this one, is done for Ghana Health Service. So they are going to own it. And it is going to be disseminated down to all the levels of care, from the CHIP compound to the primary health care coming up, so that healthcare workers, when people come to hospital, they will see this person is at risk because of it's free. If you are huge and your body mass index is even high, you have a risk factor, things like that. You take somebody's history and then you get to know that there's a family history of hypertension. The father or the mother have got hypertension or diabetes. You're also at risk. You need to screen. In fact, age itself. Once you get 40 years old,
it's a factor.
It's also a risk factor.
You are at risk.
So those are the key things that are highlighted, so that together, collectively, we can identify the at risk. We screen them early. Simple tests that we can do, including just collecting your urine.
Okay.
And actually detect that.
We'll come to talk about what you launched today and how that benefits those who are going through treatments and those who don't know their status and what they can do to get ahead of this particular matter. But Deepak, how does AstraZeneca come in?
AstraZeneca is a global-led biopharmaceutical company, and now is a household name after
COVID-19,
right?
I remember two shows of it.
And I think one of the passion which our CEO has is about equitable access and playing a role giving back to the society. And I think important piece is about AstraZeneca and sustainability. And it's not new. If you look at AZ Forests, which was being done in Ghana for years, where we have planted around more than 4 million plants. So it's giving back environmental protection. Then picking up some of the non-communicable diseases, which has very low awareness. And that's what Professor was talking about. Till the time you get to know you are in the late stage of chronic kidney disease. Till that time you get to know you are already into, from diabetes, you are at the stage where you will be using insulins. Till you get to know you are into couple of poly pills for hypertension. So how do we empower the primary health centers and enable the patients and the caregivers and family who take health in their hand? That's something which AstraZeneca is working from a sustainability aspect.
So this is your role?
Yes, this is our role. And it's not, I think one thing which is very, very clear is that we can't do it alone. Right. And that's why the public-private partnership comes into practice with societies, with NHI, with the Ghana Health Services, with government, coming together and seeing where we can join hands to make sure that we halt the progression. And we don't talk about treatment always, we talk about prevention.
Right.
And that's why Healthy Heart Africa has been running for last 10 years. We just celebrated a decade of celebration for Healthy Heart Africa.
Right.
And now we are bringing chronic kidney disease because that's an alarming burden which is erupting like volcano in incoming.
So I just want to find out how you are playing this role.
What we're doing is we're bringing the idea with the expertise and saying how we can handhold to bring this screening at a mass level, and also create awareness programs by building capability of training the healthcare professionals through the protocols, guidelines, and at the same time bringing awareness along with joy in terms of going to every household and say, if you have risk of hypertension, if you have diabetes, do not miss out on getting screened for chronic kidney disease.
I think this is very important. I remember, awareness about kidney became quite pronounced after the Kolebu Teaching Hospital. And I remember even in the newsroom, everybody wanted to know, so what should I do to prevent me from damaging my kidney? And I think one key matter that stood out was the fact that you should take a lot of water. And the next day, everybody had a bottle of water by him or herself. So it means that people, they dread the disease, if you like. But we don't take the responsibility of knowing our health status. And that is a general Ghanaian problem. So how are you hoping to drum home this awareness creation such that people will become more alive to their health responsibilities?
Thank you very much. So, of course, what we are doing is part of it, working with the media to try and let people know what are the risk factors. So if you hear us and you know that definitely your body mass index is high and you're obese, you are at a bit risk of hypertension and diabetes and therefore kidney disease. So that's fine. But what this, let me just part AstraZeneca, they've done quite well. I mean, a pharmaceutical company, you would think that they are interested in manufacturing drugs to treat people.
Of course.
But here, they are hammering home prevention, screening for prevention. So that is very magnanimous on their part for doing that for us. What this protocol is trying to do, because it's going to be made for Ghana Health Service, it's going to be made available at all levels of Ghana Health Service. It is there. Healthcare workers who are there, when people come to hospital, they will know that probably you got the risk factor. And then they will know the simple thing they can do at their level to detect whether you've got chronic kidney disease or not. If you have gotten, there are also instructions. What do you do up to the point where you will need to probably refer to a higher level? That is how this is coming in for people to know their status. But other support we also get from partners like AstraZeneca and the rest is that there are a lot of health days worldwide that we do. Just last week, we celebrated World Kidney Day. When those days come, we do a lot of screening. And we partner them. They support us. They sponsor us. They provide a lot of logistics for us to run these things. So doing screening, doing just health screening on days like that, whether it's a cardiovascular or diabetes day or kidney day, are also very important ways. And we are not just doing the screening. We also do the education. For me, the key things are the risk factors. So if you have the risk factor, probably you haven't got an advanced kidney disease, yes. But if you've got a risk factor, and then you come for screening, a very simple test we can do to screen. Then we can identify you early and put in prevention.
I mean, and the issue of our cost will be a concern for many. And I'm sure a lot of people are asking, how much would it cost me to do the screening?
Okay. So they are very simple, very low-cost tests that you can do. Checking your blood pressure. Let me say this. During the diagnosis crisis, I think the ministry representative, doctor from Bono East region, that was when I even got to know about this wellness clinic that Ghana Health Service has created, where you don't need to be sick before you go there. You just walk there and say, I want to just check my blood pressure, my sugar. You understand? So those ones are not expensive. Going to check your blood pressure and going to check your sugar, I'm told that they are working even to get Ghana, the health insurance
to cover it.
That. So that anybody, at least once in a year, if you are not being sick, you can go there, get your blood pressure check and your sugar. But simple tests like your urine, you collect your urine. There's a stick you dip into the urine. And if you have got a chronic kidney disease, it will show. And that can be as low as 2 cedis.
Right.
2 cedis. So it's not that expensive. Checking your blood pressure may not cost anything. Checking your sugar may not cost. And just doing your urine may also not cost, even though there are blood tests that we can also do. But these simple ones I have said are very key things.
So AstraZeneca, is this a social responsibility program?
Yes.
What really is the motivation?
I think motivation is in terms of bringing the outcome and improving the outcome of the patients. I think 2 statistics I was very amazed to hear and brings a lot of risk is 70% of the patients or people do not know about hypertension.
Of course.
And then 75% of the patients who are at the risk of chronic kidney disease, they reach at the stage 4 in the hospitals. So if we can delay the progression by just a simple screening, a simple awareness, knowing that if you have these risk factors, do not ignore, because that will be expensive. Not a screening is expensive. Not getting a simple test is expensive. What is expensive is if you are ignoring your symptoms and the risk factors and you land up in the tertiary hospital, it's going to be very, very expensive. So this is just a kind of a motivational aspect which AstraZeneca got it, along with the partnership of societies, that we can do a lot together. And we've seen it. We've seen it in the last 10 years where we were and what we have done with hypertension. Adding chronic kidney disease will be making sure that we delay the progression and helping our families, because we are also patients today or tomorrow.
Of course.
Right? So if we have the health in our hands, why not the families and people of Ghana and Sub-Saharan Africa doing it as well?
And has this started already?
So today was the day of kickoff and launch of Healthy Heart Africa 2.0. But as I said, Healthy Heart Africa has been there for 10 years.
Right.
Now we're integrating CKD screening as well along with it, because we know that's the biggest burden we see. And because we don't have experts like him, we have to replicate experts like him, which will take time. So what we need to do is we need to bring this feed into the primary health centers, and they become nephrology support as the professor and start screening these patients, and if they have risk factors, start treating them there itself.
And are there identified places that this is taking place, or all health institutions?
For the guidelines we have developed it in partners for Ghana Health Service, and so they are going to print more copies and different levels of care. So it depends on your level, where you are. If you are just a physician assistant or a nurse or something, a different level. So that will be made available. Not very big, very written, very simple language, so that it is there for people to just look through it, so that when somebody comes to hospital, you can see that this is what I need to do at this level.
So I think it will be all primary health center.
Right.
That's where we will be pushing the protocols, guidelines, educating, building capability with the paramedic staff, nurses, and the physicians. And then they will be capable enough to identify the risk factors, screen them, diagnose them, and then send it across to the secondary or tertiary centers.
And you are targeting everybody.
Yes, the public. Because that's what we will get to know, what the real incidence of chronic kidney disease is. Because hypertension is very, very prevalent. Diabetes is very prevalent. If these two are, that means for sure chronic kidney diseases.
Prof, before I let you go, maybe your final advice to people who are watching, and they're thinking, tomorrow I'm just going to carry my bag and walk to a health center and have it checked.
Yeah, for sure. So I think our health-seeking behavior needs to, we need to up our game a bit. Somebody will be boasting that, as for me, having gone to hospital for 10 years.
Yeah.
I don't think those are the things we need to be saying. Having gone to hospital for 10 years and you are boasting in that, you don't need to boast in that. At least once a year, if you are not even sick, just go to hospital. And the thing is that once you are growing above 40, naturally,
you are prone to a lot of things.
A lot of things, hypertension, diabetes, and those things. So let us all take our care quite seriously and offer ourselves just for checkup. But once again, I will end by talking about the risk factors for CKD.
Sure.
So if you are obese, your frame is huge and you're obese, you are a risk factor. If you have been told that you have hypertension, don't just ignore it.
You may not exhibit fatness. Your body index system, you may look slim according to your own standard,
measure.
but you may be obese.
You go and measure, yes, you want to go and measure. So it's important, just you are weighting your height. So get that one done. Just get your blood sugar check. If you have been told that you have got diabetes, your sources depends on well controlled. If you comply with treatment and the sugar is well controlled, then the risk is eliminated largely. And so do not neglect being adherent to therapy to follow up, things like that. Let us also be very careful about painkillers. I've mentioned it previously in my engagement with the media. Painkillers are dangerous for the kidneys. In fact, nephrologists will rather call it painkillers. We will say they are kidney killers. Killing our kidneys. So we are very much worried when even our own colleague doctors are prescribing painkillers for people with doses, they damage your this thing. Uncertified or licensed herbal medication is a major problem that we face. People should have these things in moderation, because even orthodox medicine, we know, I'm telling you about painkillers, they can damage your kidney. So in the same way, herbs,
ones that are not tested.
You understand that test they can also.
Deepak, your final words?
My final words is all the efforts we are doing will go waste if people do not adapt it. And I think as Sir said, one health checkup per year does not cost you. What costs you is ignoring it, landing into the hospital. So my humble request is, do not ignore your risk factors, which is basically if you are obese, sedentary lifestyle, you have risk factors like diabetes, hypertension, go and get yourself checked. You may be amazed, you may be surprised. So take health in your hands, and I'm sure together will make it much more equitable access for screening, diagnosis, and surely halt the progression of such kind of burden.
Thank you so much for your time this afternoon, Deepak Arora, African Cluster Country President at AstraZeneca, and of course, Professor Samson Emchi, President of the Ghana Kidney Association. And tomorrow, all of us will line up to have our health checked. Thank you so much for coming through this afternoon. This is still The Pulse here on Joy News. Let me focus on road safety. From kidney, we can now talk about accidents on our roads. And the Director General of the National Road Safety Authority, Engineer David Osafo-Adontem, says plans are far advanced to introduce an initiative dubbed Passenger Manifest. It aims at keeping records of every Ghanaian passenger in all the commercial transport vehicles. Now, the move is expected to help identify victims in the event of any accident. And he's been speaking to Joy News.
Currently, we started a pilot a couple of months ago, last year, and we are still doing it. If you go to Kaneshi Station, the New Plant Station, and some of the terminals, you get there, and then we ask you of your name, where you're coming from, where you're going, and then you give us the contact, your personal contact, and then the contact of any person you think we should call, in case there should be a crash. In fact, in the beginning it was very tough, because you know Ghanaians, as if they do not want to hear a crash at all. But it is something that could happen anyway. I think people are beginning to understand and appreciate. So now they are giving us the figures. They are giving us the data. We are compiling the data. The good thing is that we are doing it electronically. So once you give us the information freely and openly, we gather them into an electronic data. And as you move along, we also monitor the movement. Currently, we have installed what we call trackers in most of the commercial vehicles. VIP, Metro Mass, Ayalo, all those ones are now, in the next couple of months, will install the devices. What it means is that even as you are on board, we are monitoring your movement in real time, from your origin to your destination. What we are trying to do is that we want to protect human life as best as possible. So we'll be monitoring the driver's behavior and then monitoring the way he's driving in real time, so that we try to prevent something before it happens. Now, the advocacy, you know how far it's taken us. Now, government has taken it upon itself to dualize between Osino, somewhere around Osino, there's a bypass, Enyinem, Enyinesini, and then Konongo. Works have already started, and if you go there, you can see it in real time that dualization is gradually catching up the entire Accra-Kumasi corridor. There is also some dualization that have started on the Aflao stretch, another one on the Winneba Road.
And now let's talk about water, because March 22nd marks World Water Day, an annual United Nations observance that highlights the importance of fresh water. The day is also used to advocate for the sustainable management of freshwater resources. For about 30 years, World Vision has been working in impoverished areas to provide safe water, improve sanitation and hygiene, as well as education about illness and diseases, health improvement, and the burden on women and children is also lessened as a result of that. Now, joining me in the studio is Yao Ata Ahin, water sanitation, hygiene technical specialist, World Vision, and he joins me to talk more about this. Yao, you're welcome. And it's really good to see you.
It's been a long time.
It's been a very long time.
Days.
Of course.
Right.
Right.
Wow.
Right. You're welcome.
Well done.
So water and your connection to it. Tell us more about it.
Yes, so I'm sure you are aware that, let me say good evening to our viewers. You know that water is life. Water is an enabler. Water is a catalyst for growth and socio-economic development. In fact, basically, no strategy for poverty reduction can ignore people's vital requirements for safe drinking water, of course, and sanitation. World Vision Ghana is a child-focused relief, development, and an advocacy organization. We are very child-focused. In fact, our vision for every child is life in all its fullness.
Right.
And our prayer for every heart, the will to make it so. But we believe that nothing can be more important to child well-being than access to sustainable, safe drinking water and improved sanitation. And that is why we have prioritized that as our number one intervention in this country. Across the country, we are in 14 out of the 16 administrative regions.
Right.
And we deliver safe drinking water. We have invested heavily into it. And we believe that that is the way to go. If we want to achieve any of the sustainable development goals, we have to achieve goal 6, which is availability and sustainable management of water. Resources.
Mm-hmm. I mean, you kept bringing in the safety aspect of water. And I mean, it resonates with some talks in my head about the danger or the threat to our water bodies, especially with illegal mining and other things that is threatening access to quality water. And in time past, we've been told that if we don't do anything about what is happening now, we may have to import water. And already I'm told that even in South Africa, they are importing water from Zimbabwe. So water is becoming a global, issue. But as we narrow the discussion to Ghana in terms of the threat that water faces, Galamsey and the others, have you done some work around it? And what should we do going forward so that we can have access to safe, especially water?
Yeah. In fact, across the world, Ghana is blessed with water resources. In fact, you will know that we have in excess of 53.2 billion cubic meters of renewable fresh water every year. So we are blessed. Unfortunately, it appears that we are not managing it safely. In fact, the turbidity levels, the pollution levels of our water bodies is becoming very, very alarming.
And this month, for example, the Ghana Water Company said that they were cutting their production by 30% in the central region. Already, they are unable to meet demand.
And these are places, which require the demand a lot more.
Right.
And these are places where the pollution is so heavy that they have to spend a lot more on chemicals. And sometimes the machine can simply not, produce or treat. But I think we need to do something about it. Elsewhere, this is a national security zone. Water bodies are national security installations.
Right.
And you cannot go closer. And I think that is the same approach we also need to adopt if we have to preserve and then protect the water bodies that we have.
And as we look forward to March 22nd, what is the focus of World Vision?
So this year, the theme for World Water Day is Water for Peace. And I'm sure you are aware that
election is around the corner.
Perfect. And you see, when water is scarce or polluted, or when people don't have, equitable access or no access at all, you can be sure that it can serve as a source of conflict. And across the world, there have been conflicts as a result of disagreements over access to water. And so at World Vision Ghana, we have also decided that we are going to take up the advocacy, the sensitization with all the policymakers and also the stakeholders that we work with. For we believe that if we're able to make water accessible to the population, then it gives them that impetus, that enabling environment to be able to come out of poverty.
Yeah, thank you very much. Tahen is with World Vision.
Pleasure.
And we're looking forward to the day.
Definitely.
That will come and support. Well, folks, that's our show for this afternoon, this Tuesday's edition of the Pulse here on Joy News. My name is Elton Brobe. For more stories, log on to our website, myjoyonline.com. Let's talk showbiz is happening on your television. Have a great evening. Whatever you are up to in the hours ahead, I hope it's profitable.